The federal government reacted swiftly today, announcing it would appeal a federal court decision striking down controversial cuts to refugee health care. The court says the cuts are especially damaging to the welfare of children who've been brought to Canada for a better life. Michael Couture reports.
Angelique Mwarbu is a refugee from the Congo. When her daughter was born in Canada, she was anemic, and immigration health care rules made it difficult to get the medication she needed. She's healthy today, but we have to watch her, she says. But that's only because an advocacy group fought to get her the medication. The government says cutting off health care for suspect refugee claimants 2 years ago has saved $600 million. Today, a federal court decision slammed the cost-cutting measures, saying they are cruel and unusual treatment of newcomers to this country. Justice Anne McTavish said they, quote, potentially jeopardize the health, the safety, and indeed the very lives of these innocent and vulnerable children in a manner that shocks the conscience and outrages Canadian standards of decency.
The decision vindicates the defiance and resistance.
Doctors and lawyers fought for 2 years to overturn the changes, hoping refugees could get the same coverage as Canadians on social assistance. And now they feel the way forward is clear.
If they didn't go back to something identical to the old policy, we would, it would be an infringement of the court's decision.
We'll be appealing this decision.
But the government is digging in its heels in the name of taxpayers.
Canadians understand the need for these reforms. They don't want to see abuse in their immigration programs.
Opposition parties disagree, pointing out most of the health care costs associated with this program are being passed on to the provinces.
To save a penny federally and then to have to spend hundreds of dollars provincially makes no sense because it's the same taxpayer who is paying.
Now, the government has 4 months to come up with a new plan. In the meantime, Mwarbu is grateful to have the medication she needs for her daughter. Michael Couture, Global News, Ottawa.